Good afternoon, everyone. Welcome to Healthy Living Together. A few housekeeping items. Your microphone is automatically muted, and you can use the Q&A function at the bottom of your screen to ask any questions you may have. This event will be recorded and a link will be sent in a follow-up email. Our guest speaker today will discuss the signs and symptoms of potential usage of drugs and strategies for communication and intervention. Our speaker today is the Director of Human Services, Emily Holmberg. I, Kristina, is the dietitian here at McKenzie, and I will be your host this afternoon. At this time, I will turn our presentation over to Emily Holmberg, and she'll discuss the signs of drug use.
Hi, everyone. Thank you for having me. So let me just take a minute to share my screen. All right. So my name is Emily Holmberg, and I am, as Kristina shared, I am the Director of Human Services with McKenzie. I also case manage the Substance Abuse Recovery Program here at McKenzie. Today, we're going to be talking about the warning signs and risk factors of substance use. To start off the presentation, I'll be going over a general overview of a few warning signs, and then we'll be delving into potential risk factors that could lead to substance use disorder in the future. Please remember that this information is designed for educational purposes only. We're not here to diagnose anyone or make note that any particular risk factor or warning sign is a direct line to substance use disorder. Each person is individualized, and no one factor can lead directly, is a direct indication of substance use. So with that, let's get into the criteria. So here we have some common warning signs. These are just some general responses that you may want to look for. Again, no one thing can indicate substance use. Here we have, look for some general risk taking when using, such as driving or having unprotected sex, neglecting responsibilities at school, work, or home. So is someone regularly a straight A student in school and then suddenly is missing class and failing out of certain classes, and same thing with work and home. Also look for legal troubles, such as arrests for disorderly conduct or driving under the influence. Some other warning signs that we have here are physical. So that would be bloodshot eyes. Are their pupils larger or smaller than usual? Changes in appetite, sleeping patterns, physical appearance, unusual smells on the breath, body, or clothing, or impaired coordination. We also have behavioral warning signs, which would be drop in attendance or performance at school or work, engaging in secretive or suspicious behaviors, also a sudden change in friends, favorite hangouts, and hobbies. And then we have psychological. So that would be unexplained change in personality or attitude. Is there a sudden are there sudden mood swings, irritability? Do they appear spaced out or having angry outbursts? And they could appear fearful, anxious, or paranoid with no reason. And a lot of these are things like sudden changes. So if someone is depressed or known to struggle with their mood, and they have a mood swing, and it's something that they're working on, I don't want you automatically thinking, oh my gosh, are they using substances? It's something to just be aware of. So now we're going to look at risk factors. These are the 3 main risk factors that I'm going to be going over today in this presentation. The first is going to be looking at adverse childhood events. So, and then the next is going to be environment versus biology, and looking at co-occurring disorders. And then we're going to go into a specific example of a co-occurring disorder. So I'm excited to talk about that. Okay. So like I said, adverse childhood events, or ACE score. And this is, an ACE score is a list of questions that assess for possible traumas that have happened in childhood. These could include all or any types of abuse or neglect, parental substance use or mental illness, parental incarceration, domestic violence, and divorce. So these lead us to ask, why would this be significant? What is the purpose of completing or learning of an ACE score? So the Behavioral Risk Factor Surveillance System has data that was collected from 25 states from 2015 to 2017. And that showed that 61% of adults reported experiencing some form of ACEs during their childhood. And approximately 1 in 6 reported experiencing 4 or more ACEs. Studies show that the higher number of these experiences are associated with poorer mental and physical health outcomes, chronic medical conditions, employment difficulties, and lower educational attainment in adulthood. ACEs are positively correlated with substance use disorder and SUD, substance use disorder risk in adulthood. Parents who have used also indicate increased risk for children to use. ACEs and SUDs have also been seen to have an intergenerational effect. So if your parents are using, there's a much higher likelihood that the child will use either as a child or in adulthood. Exposure to parental substance use is an ACE that is associated with increased risk for substance use. So as you can see, it's very important to, 1, identify, because when you can identify, it's easier to treat. And then 2, to make sure that you can hopefully avoid these poorer outcomes. Okay. So now we're going to go into environment versus biology. And this leads back to a little bit what I was talking about before about parental use. You have biological factors that increase risk of addiction. So what are one's genes? That's something we can't control. Some people are biologically more predisposed to have a substance use disorder. And if you know, as an adult, if you know that your parents or your grandparents have some sort of substance use disorder, it's even more critical for you to avoid that use, because you can be more predisposed to addiction. And then in terms of biology, stage of development, when you first use. So if someone uses at the age of 12, 13, 14, 15, your brain is not fully developed, and that can interfere with your development of your brain and cause difficulties in the future. And then also gender and ethnicity play factors as well. Then we have environmental factors that increase the risk of addiction. So that's home and family. The home environment, especially during childhood, is a very important factor. Parents or older family members who use drugs or misuse alcohol or break the law can increase children's risk of future drug problems. They see that it's okay. And then you have peer and schools. Friends and other peers can have increasingly strong influence during the teen years. Teens who use drugs can sway even those without risk factors to try drugs for the first time. Struggling in school or having poor social skills can put a child at further risk for becoming addicted to drugs. And then the other factor is, how was the drug taken? There's a lot of evidence that shows that addiction happens easier, I'll say, when, let's say, someone used an opioid through IV rather than orally. So now we're going to get into co-occurring disorders. So what is a co-occurring disorder? It's any combination of two or more substance use disorders and mental illnesses. And so I have a list later that I'll show you. Any certain substances can cause people with an addiction to experience one or more symptoms of a mental illness, of a mental health problem. So a substance can cause depression. And then mental health problems can lead someone to alcohol or drug use. Some people with a mental health problem may misuse these substances as a form of self-medication, which again is something we're going to talk about here in the next few slides. I'm going to get into anxiety, and people are using, it's common to see marijuana being used to treat anxiety. So we're going to talk more about that here in the next few slides. And it's important to know that some substances can induce mental illnesses like bipolar, schizophrenia, paranoia. They can be quite severe. And it could possibly be that you have, when you stop using the substance, that the mental illness may go away, but it's possible that it may stay. So then we have mental health and substance use disorders share some underlying causes, including changes in the brain composition, genetic vulnerabilities, and early exposure to stress or trauma. So really, we have to determine what came first, the chicken or the egg, and what are we looking to treat. So if sometimes it may be, well, we have a mental illness. If I come to you and I have a mental illness, I have depression, but I'm also using substances such as heroin or fentanyl. It has to be determined which one is of greater risk and what needs to be treated first, which we'll get into. So here's the list that I have. So again, it's any combination of two or more substances, substance use disorders, and mental illnesses. So we have anxiety and other mood disorders, schizophrenia, bipolar, major depression, conduct disorders, post-traumatic stress, and attention deficit hyperactivity disorder. And then you have alcohol, tobacco, opioids, stimulants, marijuana, hallucinogens, and prescription drugs. So you can see possibly stimulants, could potentially lead, stimulants could potentially lead to ADHD. And we've talked about marijuana and anxiety. So they're all important factors, and they're all intertwining. Okay. So now we're going to talk about treatment for co-occurring disorders. What does treatment look like? It's not all the same. That's the first, and that's the most important thing to know. It must be identified by professionals. And I think the best course of treatment, the best treatment plan, is one that integrates each of these professionals. There can be times when patients are seeking treatment for opioid use disorder and maintain sobriety through medication-assisted treatment, and then they can suddenly discover a mental illness. So when I'm working with patients who are receiving this medication for an opioid use disorder, it's common to see that. It's because substances can mask mental illnesses, right? So when you don't feel good, you use the substance, and that makes you feel better for a time. So then you start treating the substance use disorder, and it's like pulling layers away of an onion. So you pull away the opioid use disorder, you're treating that. Now all of a sudden you have, you discover that this patient has a major depression disorder and is struggling to get out of bed, and is struggling to, with depressive thoughts and possibly thoughts of suicide. And those are things that need to be addressed. You can also have another patient who comes in to receive treatment for substance use disorder, who has mental health needs that are so great they supersede treatment for a substance use disorder. So let's say someone comes to see me for treatment for opioid use disorder, and they tell me that they're suicidal. Well, I'm not going to have someone sitting next to me saying that they're suicidal, and I'm going to say, here's your Suboxone, be on your way. Clearly, the mental illness takes priority, it takes precedence. And so we have to treat that first. And then once we get them stable and maintained, then we're going to be able to treat their substance use disorder. There's no one way to treat a co-occurring disorder. Like I said, each plan has to be individualized. And then each individual, like I said before, the most important and the best way to treat someone is with the whole person in mind. So that's mental health professionals, substance use disorder professionals, and primary care professionals. So you want to have someone receiving primary care, because another layer of that onion could possibly be that they have diabetes, or I commonly see malnutrition. And so I've had people come to me and say, I feel better, but I keep gaining weight. And so that's when we talk about nutrition and how your body is lacking in nutrients. And so how can we best treat you and your whole person? Okay. So as promised, we're going to talk about marijuana use and anxiety. So first I want to talk just a little bit about marijuana. The two most common, so marijuana consists of over 500 components called cannabinoids. The two most common and the most researched cannabinoids in the marijuana plant is THC and CBD. THC is what has the psychoactive properties. THC is what generally is associated with euphoria, the relaxation feeling, decreased motor activity, a sense of calm, among other things. CBD is what you see like the CBD oils and things people are using for like their joints to maybe help with inflammation. It's non-psychoactive properties. And interestingly, CBD has been known to reduce the effects of THC, including intoxication, sedation, and tachycardia. So the two kind of balance each other out. CBD kind of makes sure it keeps the ratio on a better level, I guess we'll say. So continuing on with that, we're going to talk about the THC levels. So the National Institute on Drug Abuse shows that the THC levels are low is less than 1%, medium is 1 to 5%, high is 5 to 10%, and very high is 10% and above THC levels. And so I'd like to refer here to this graph here. So it's a little outdated, but I still think the point gets across. So if you look here, I don't know if you can see my laser. In 1995, the THC level was 4% in that marijuana plant. And what would you say that is? A little less than 1% for CBD. So then you keep going and you can see a continual rise in THC levels. So to where we get to 2014 and the THC levels are as high as 12%. So according to the National Institute on Drug Abuse, that's considered very high levels of THC. And then we'll look at CBD, which is showing a decline. So there's less CBD and way more THC in this marijuana. So as we talked about before in our last slide, these counteract each other. So this euphoria, relaxation, decreased motor activity, and sense of calm is increasing while the CBD is decreasing and is not helping to avoid this intoxication, sedation, and tachycardia. So then we'll talk about tolerance. It's easy for regular marijuana use, as short as a few days, can develop a tolerance. So any of the benefits from the THC that helped with mental illness could now exacerbate those symptoms. So let's say if you have anxiety, right? You're over here with your anxiety and you're struggling, let's say socially, you're struggling to get out and you have some maybe agoraphobia. So then if you have, you use marijuana and you're like, gosh, I feel great. This is really helping. The more you use, the less it works because you become dependent and you develop a tolerance. And so if you find if you stop using the marijuana, your anxiety gets worse because, as this says, it exacerbates those symptoms. So you become more dependent on it. So because you've developed this tolerance, now you can't leave your house without using marijuana or some type of substance. So you can see how it's a revolving door. And I can't talk about marijuana without talking about marijuana concentrates. I just want to briefly touch on this. Marijuana concentrates are commonly called like dabbing or wax, which has a THC level that can be as high as 97%. So here we are looking at, in 2014, we saw a height of 12% THC, and here we are talking about 97%. So dabbing is a term used to consume high levels of THC. This is done by using a vape pen with a dab or wax product. The marijuana plant, so where it comes from, the marijuana plant produces an outgrowth on the leaves that can be collected and processed down into a high concentration of THC that forms a waxy substance. And this can lead to anxiety, agitation, paranoia, and even psychosis. And so, it's just very important to note how different marijuana is from what it used to be, even back in the 90s, back in the 70s, when you saw 2% THC, 3% THC. You can't find that now. And then I'd also like to note that 10% is considered very high. And I would almost argue that that these levels need to be changed, because low being considered less than 1%, we don't even see that anymore. So what do we determine a THC level that's 97% and 10% are both considered very high? So I think there's a lot of changes as marijuana has become legalized. I think there's a lot of changes that need to be addressed and a lot more research that needs to happen. So we'll get into the anxiety portion of the co-occurring disorder. So the risks of using marijuana-induced anxiety. So individual and genetic vulnerability, personality traits, female gender, high doses, so that marijuana concentration that we're talking about, and then just the high levels of THC combined with the low levels of CBD. I read a study by the University of Washington that determined that a low dose of THC at 7.5 milligrams appears to show a decrease in anxiety, while higher doses of 12.5 milligrams were shown to produce small but significant increases in anxiety and negative mood. So then they had, the University of Washington also studied CBD and its effects on anxiety. So this study gave 300 to 600 milligrams of oral CBD, which reduced experimentally induced anxiety. So someone who didn't have anxiety in the past or any kind of diagnosis of it was given some kind of stimuli that caused anxiety. And then they gave them 300 to 600 milligrams of CBD, and it was shown to have reduced that anxiety. It's important to note that this is all very preliminary, and a lot more, we really need more clinical trials to show how CBD can affect and potentially reduce anxiety. So with that being said, I'd like to now talk about or show you what is available, what services are available to you as the community. So I'm going to show you this clip here. Kristina, if you could let me know if you can't hear the sound, but I think we should be okay.
Are you prepared for the most important conversations you'll ever have? Everyday moments are great times to talk with your kids about underage drinking and other drug use, because talking early and often lets them know your expectations, reinforces your message over time, and promotes ongoing open dialogue instead of just one big talk. But what do you say? And how do you say it? The Talk They Hear You mobile app is your guide to get informed, be prepared, and take action to talk with your kids about underage drinking and other drug use. The app is designed for parents and other caregivers, educators, and community members who play important roles in children's lives, like coaches, faith leaders, and others. The app provides guidance for talking with kids in a range of situations so that you can be prepared to talk about underage drinking and other drug use when opportunities arise. For each different scenario, the app helps you set a goal and gives you suggestions for how to start the conversation with your child. And it also helps you anticipate what your kid might say when you bring up these subjects, helping you plan responses in advance to keep the conversation on track. When you're ready, the app lets you practice and record yourself so that you can review what you said and make adjustments if needed. Remember, talking about underage drinking and other drug use works best when it happens naturally in everyday conversation, so practice several different situations. The app also puts additional resources at your fingertips, useful information about alcohol and other drugs, and how to help your child stay safe. So download the Talk They Hear You mobile app today from the App Store, Google Play, or Microsoft Store, and see how easy it can be to talk with your kids about underage drinking and other drug use. Because when you talk, they hear you.
So you can, I should have prefaced this a little bit, but you can see there's a really good app developed by SAMHSA, helping you learn and know how to talk to your kids specifically, but I think that information can be transitioned also to adults as well. Just gives you some really good tips and tricks. I'd like to exit out of my PowerPoint here for a second, see if I can do that. And I just wanted to show you this website here. So this is the website by SAMHSA, just going into Talk They Can Hear You campaign. And there's other campaigns as well. SAMHSA is a really good resource for people who are looking for help with substance use disorder and mental illness. So it's a good website to just kind of peruse and look through. So I just wanted to show that to you briefly. And back here. And then the next thing I wanted to talk to you about is Narcan. I can't talk about substance use disorder without talking about Narcan. So I don't know if you can see this, but this is Narcan. And it's so important to have, not only if you suspect someone has a substance use disorder, but anytime there's an opioid in the house. So if you're prescribed an opioid for any certain reason, you really should have it in the house. You just don't know if there is ever an accident where someone consumes too much, even unknowingly. We don't know why, but this Narcan will reverse any accidental intentional overdose that can occur. So I have here Crystal Bell. She works for the health department, and she is able to train and give away Narcan for free. So I just wanted to put her her phone number up here, or contact information, to reach out to her to get Narcan if you're interested. And then Crystal also has some free individual sessions for teens for prevention education for mild to moderate substance use. And that is about it. So this is my contact information. I'm Emily Holmberg, and I work with McKenzie. And please, if you guys have any questions, feel free to reach out. I'm here. So, and then these are just my citations. So that's it. Thank you.
Thank you very much, Emily. We really appreciate you bringing this to our attention. At this time, you may use the Q&A function at the bottom of your screen to ask any questions you may have for Emily. So Emily, if someone has gone over the common warning signs and they feel that someone does need treatment, what would the steps entail?
I think the most important step would be to reach out to get help. I know we talked about co-occurring disorders and which one's most important. You know, do you reach out for someone for substance use treatment, for mental illness? And the most important thing is to just reach out, because I've had people come across my desk wanting treatment for substance use disorder when I can see that the primary need is mental health. And so we just then have a warm handoff to get them their mental health treatment until we can treat them for their substance use. The most important thing is to just reach out, make the call. They can call us, my contact information, community mental health. We're all here.
Thank you, Emily. And someone put, Crystal said, thank you, Emily, great job. I agree. This information was very informative. I learned so much that I didn't even know about.
Oh, well, thank you. That's great to hear.
If anyone else has a question, the Q&A function is on the bottom of the screen and you can type your question. All right, it looks like we don't have any questions, but I would like to invite everyone to participate in our next Healthy Living Together. It's on August 16th. At the same time, it's going to talk about preserving your Michigan harvest, and it will be presented by Lori from MSU Extension. And we hope that you guys join. And again, this video was recorded and will be available on YouTube.